So thank you very much. I'm now going to turn the mic to our discussants. We'll start with Dr. Jooyeoun Su, who will discuss the first two papers. Dr. Su?
Can you see the screen? Okay. Okay, so I'll be very brief. I'll talk about Kebongo's and then Gretchen's paper. So it's a very interesting paper. Thank you for giving me opportunity to read a PowerPoint and think about the paper. And I love the idea of a holistic way of combining all paid care as well as unpaid together and by all age groups. And but then I have some questions about the consumption side. It was okay for me to understand the production side. It was easier for me to understand, but I had some clarifying questions on the consumption side. So with the household expenditure survey, how did you translate dollars into time? Because everything is in hours. So especially for paid care workers. And if this is only calculated by with the household expenditure surveys, then I wonder whether the numbers could lead to underestimating the total financial cost. So for example, what are the roles of government subsidies or supports and things? Because what families pay is not the total amount for that care. So how does that play a role in there? And also it's known that time user survey data often underestimates, as Jooyeoun already mentioned, and then you also mentioned in the presentation. So they often underestimate time devoted to unpaid care. And I think that this is more of an issue for elder care than child care. And I understand that you included supervisory care and a secondary child care for the US case, but those data is not available for Korean time user survey data. So any thoughts on how to overcome those underestimation problem or issue? And I'm also curious about your thoughts on the economies of scale. For example, there are greater economies of scale for unpaid care compared to paid care. You don't need to double the amount of time to care for 2 children, I think, at home. But if you need to send your kids to paid care daycare centers, so for example, then you need to pay double. So there is a economies of scale in there. So I wonder whether you've thought about those points. And also, maybe it's not too relevant to your paper, but the next point is the substitution between paid and unpaid work. Since you combine them together, so it may not be really relevant, but I'm curious whether there is room for reflecting possibility of imperfect substitution between paid and unpaid work, because you can assume that those are perfect substitution, but maybe not. So then, the last but not least is, where do we go from here? So you have this measurement, you have this analysis. So how can we apply this to the policy sphere? And Jooyeoun's paper, another interesting paper, and I love how she started. Unpaid work is also work. I totally agree with her, with you on this. And then it clearly showed why it is important to measure and then value, and how substantial those value of unpaid care work in Korea is. Yet, as Jooyeoun also mentioned in her presentation, that there is no consensus how to measure and how to value these care work. So was there any quality adjustment for valuation when you did the replacement cost method? I wonder whether you thought about, or maybe it's not necessary, but I wonder whether you have any thoughts on that. And also you mentioned that underestimation of care time. Even though you put this time with the children during leisure time and then some voluntary work, I think a 4-point-some% compared to GDP is considerable, like extremely low in my opinion. I've looked at some other countries, and then as you already pointed out, that the 2008 data already showed that it's a fairly low. So why do you think it's the case? And how do we amend those underestimation problem? And you did mention that household without children or household without care recipients, and then households with the care recipients providing care. But then when I looked at the graph for those households without care recipients, their time devoted to childcare and time devoted to elder care is just insignificant, almost non-existent. So, but I think in Korean context, there are a lot of households who don't live with their care recipients, but provide a lot of care. So are we capturing those between household transfers in terms of time? So how can we really measure that? And the last point about the policy, so we now can measure, we now can value, then what? What is the next? What's our next policy? What are the ways to support the unpaid caregivers, and also are there policies? Maybe there is no one policy that can solve all these problems, but is there any policy that you can recommend for solving unequal division of labor at home, as well as increasing women's labor force participation at the same time? Even though I remember you said that the previous policies have focused too much on the increasing women's labor force participation. But I think that should not be the only objective in terms of in policy, in making policies. But I think compared to other OECD countries, it's too low. So how can we go from there? Thank you.
Thank you, Dr. Su. I now call on Sang-ho Nam to discuss the paper by Martin and Hans. We cannot hear you, Dr. Nam. Could you check your mic?
Shall we all wave to him?
Yeah, I'm going to ask now the technical team of CTMS to probably help Dr. Nam figure out the problem with his earphone and microphone.
I think he said very nice things about our paper.
Yeah, while we're waiting for Dr. Nam, maybe I'm going to give the floor to Dr. Jooyeoun and the Bongo Kai and Gretchen Danhauer to answer some of the comments of Dr. Su. Shall we do that? Why don't we start with Dr. Kai and Danhauer to answer some of the comments of Su, and then followed by Jooyeoun. I'm going to give you 1 minute, and if we still have technical difficulties, you can expand your response. Okay, so Dr. Kai and Gretchen, would like to respond?
Gretchen, can you? Yeah, I think you are better able to answer the Dr. Su's.
Sure. Can you hear me okay? Oh, great. Yeah, I think a lot of what Sue's general comments are,
Mic, USB audio device.
Now it's Dr. Nam, it's working now.
들려요?
Perfect
Okay,
timing.
so are you able to join us, Dr. Nam?
Can you hear me?
Yes, finally.
Oh, okay,
Okay.
okay.
We will wait for the response later. Please go ahead,
Okay,
Dr.
okay,
Nam.
okay. I'm sorry about the inconveniences. It was fine yesterday. But, okay, let me start my discussion on Hans and Martin. Thank you for inviting me to this meaningful event today. First of all, on behalf of my fellow Korean economists, I would like to express my sincere thanks to Dr. Hans Rofren and Professor Martin Sikowitz, who performed general equilibrium analysis using the GEM care model for the Korean economy. As far as my understanding is concerned, this is the first time in applying general equilibrium model to analyze the care issues and the gender issues as well. As you know, Korea is experiencing a rapid social change in many aspects. Above all, the discussion is hot in the political aspect and the social issues related to women. I think the study so far has lacked systematic and comprehensive analysis of the economic effect of women's care activities. As an economist, I didn't have any chance to participate in this kind of research in CG modeling. As one of the efforts to satisfy the shortcomings, I think it is perhaps essential to use the computable general equilibrium model in the sense that it is the most advanced and it's also in the most comprehensive analytical tools. It was difficult to understand for me to understand all aspects of the GEM care model developed by Hans and Martin. And it was enough to emphasize with the analysis method, results, and their policy implication derived from the research. In analyzing the gender and care issues for Korea, it is important that the CGE model is used for the first time. And furthermore, I know that there was many hidden efforts of Professor Mario Floro behind the two of the most outstanding researchers that I would like to take this opportunity to express my sincere gratitude. Regarding some technical questions, it would be better to communicate directly to Hans and Martin. And today I will just focus some general issues on the development of this research. The first thing I want to address is that in household transfers, for example, the transfers between former family members might not be fully incorporated in this kind of models. So I would like to propose Hans and Martin to integrate CG model, the current care model, and the micro-simulation model that incorporates individual data all together. And if this tool is ready, we can get more opulent results and policy implications from various policy simulations. And next, based on my experience, I have some suspicion in identifying skill level by education level. Even though I do not have adequate criteria on the measurement of skill level, I also asked some of my Korean economists who specialized in labor economics field, but still they don't have any acceptable answer for me. And we need to explicitly identify in-kind transfer and cash transfer in the models. What I have in mind is that treating in-kind transfer as a subsistence consumption in the linear expenditure system, which is derived from the Stone-Geary type utility function. The rationale behind this idea is that in-kind transfers are essentially the variables not affected by the change in the relative prices of the policy simulations. So in-kind, distinguishing in-kind transfer and cash transfer is very important in analyzing this kind of care issues. The current version of the paper considers only income tax in the analysis. But in the next stage of research, it is worthwhile to consider the corporate tax and or the value-added tax as an alternative source of financing. In this case, we can evaluate the marginal cost of public funds of the care policy in Korea. For the most comprehensive measure of change in social welfare, using equivalent variation in addition to GDP might be worthwhile to try, because using equivalent variation is quite a standard in CG modeling, as well as it is theoretically appealing, as far as my understanding is concerned. Later, we can disaggregate equivalent variation by household type without any difficulties. I would like to thank both Hans and Martin again for their excellent research on Korean economy. Please let me know if you need any assistance regarding Korean economy in the future. Thank you.
I'd like to thank our two discussants for really raising some very thoughtful questions and commentaries. Instead of me giving the closing remark, I would like to ask each of the presenters to respond 1 minute to the comments of their discussants. So I'll start with Bongo Kai, please go, and Gretchen Danhauer.
I think a lot of Sue's comments were about making this model, this theoretical calculation that we put together more realistic. And so more realistic, but then it means that we have to have a much more complicated model. And I mean, I think that there's sort of a good contrast between what we did versus Martin Hans' model is, which I think it has a lot more real world interactions and things. I think there's room for sort of both tools. Ours gives you, I think, a good look at what is kind of the current snapshot. And then if you just fix that and move forward with the population projections, you get an idea of where the pressures on the care economy are. So that's sort of, I think, the main use of it is giving that picture and then having a kind of first pass at what the future might look like. But thank you for all the comments and involved and more realistic. So thanks.
Dr. Yoon, please go ahead.
네, 짧게 1분밖에 없으니까 수의 코멘트에 대해서 말씀을 드리면 퀄러티 어저스먼트를 할 수도 있었지만 2019년에 대해서는 할 수도 있었지만 못한 이유는 안 한 이유는 이 오늘 보여드린 자료에서는 1999년부터 2019년까지 비교해보고 싶었던 생각이 있었고 1999년부터 한 2004년 정도 자료까지는 퀄러티 어저스먼트를 제대로 할 수 있는 정보가 없었다라는 점 앞으로는 할 계획이고요. 돌봄 시간의 과소 추정은 사실 굉장히 문제죠. 옆에서도 보여드렸지만 고용률도 낮은 상황에서 한국의 돌봄 노동 시간의 가치가 비중이 다른 나라보다 낮다는 건 좀 잘 이해가 안 되는 건데 아마 한국의 돌봄 노동 시간이 그 생활시간 조사 자료의 한계 때문에 과소 추정됐기 때문에 그런 거 아닐까라는 좀 생각도 들어요. 여성 고용률도 낮고 출산율도 낮은데 제대로 추정을 하면 사실 한국의 그 돌봄 노동이 제공되는 방식, 단순히 양적인 시간뿐만이 아니라 이 템포럴 디멘전도 생각을 하면 좀 설명이 가능하지 않을까라는 생각이 들고요. 가구 간의 돌봄 노동이 주고받아지는 것, 그 자료에는 1분, 2분밖에 안 되지만 사실 전체 평균 인구 연령대를 다 평균돼서 그랬기 때문에 작아지지 않았나라는 생각이 들고, 가구 간 돌봄노동 교환이 가장 빈번하게 일어나는 건 사실 40, 50대, 60대가 아닐까. 그 연령층에 한정하면 좀 더 숫자가 커질 수 있을 거라는 생각이 들고요. Where do we go from here에 대해서는 저는 돌봄노동 가치 평가하는 것 자체가 중요하다. 경제 성장 과정에서 전체 아웃풋이 어떻게 변화하는가를 비지장 차원에서까지 포함해서 보지 않으면 제대로 설명할 수 없고, 가장 중요한 돌봄 정책은 돌봄 일자리의 임금 수준을 높이는 것, 그래서 남성들도 들어올 수 있도록 하는 거 아닐까라는 생각이 듭니다. 감사합니다. 이만 답변을 마치겠습니다.
Thank you. And now Hans and Martin, you have 1 minute to respond.
Okay, thank you. Thank you very much to Dr. Nam for his comments. Couple of things only. Regarding the transfers, in-kind transfers, interestingly, we do have in-kind transfers, and we have two types of them. One, if in-kind transfers, in-kind care transfers from the government to the different households with care needs. And we also have in-kind transfers, in-kind care transfers from one household to the other one. For example, one household without elderly members can make a transfer, a care transfer to the household with elderly members. So that's something that we are considering. We will consider alternative sources of financing, like indirect taxes, and the corporate tax is part of what we are doing right now, but it will be interesting to test the sensitivity of the results to other sources of financing. And then the calculation of the marginal cost of public funds, that's very interesting. That will tell us how much money you need to raise to provide $1 of care to the private sector. It will be interesting to do that in a model that considered both the GDP and the non-GDP economy. So it's not that easy to do that, but it will be very, very interesting. So thank you.
On behalf of the presenters and the discussants, I'd like to thank all the attendees. This session actually answers the following questions. How do we integrate the care sector in our policy making and policy analysis? And can this be done? The policy tools presented in today's session demonstrate that yes, we can and we should, if we want a sustainable, caring society whose prosperity is shared by all. Thank you.
All right, thank you for the meaningful, ambitious research you're all partaking in to render it possible to evaluate care, to make the invisible work more visible for other researchers, as well as for policymakers to then implement these into policymaking. Right, there still seems to be a lot of work left, but we do await for more exciting outcomes to come in the near future. All right, thank you, Professor Floro, for moderating such an instructive, informative session.